Hi everyone, Dr. Rich Castellano, the Smile Doctor here at Lift. We're here today with Sheila. So proud of Sheila that today is her day to help her neck and her jawline. And Sheila's had her relaxing medicine, so we'll bring Sheila into. And how are you feeling, Sheila?
Great.
Looking good. We did some of the numbing medicine, we did some of the lip filler. So now what I'm going to do is we start out with our laser lipolysis. So this is local anesthesia facelift. I am a double board certified facial, plastic, and reconstructive surgeon, Katya. And a lot of people are unaware that we can do this under local anesthesia. That's something to do with. So I'm just getting my gloves on here. My team is so amazing. They have everything set up perfectly. It makes it very easy for us. Sheila, you mentioned it before. Can I ask you one more time? Tell us, what was it that inspired you to have a cosmetic treatment done?
Well, I'm active and I have a lot of friends that are much younger than me, and I wanted to look good because I don't feel good if I don't look good. And I think I want to spend my last few years half decent.
I think you have a lot more than a few years. So, very good. Well, we are honored to be a part of this with you. So what I'm going to do now, so you'll feel pressure, Jamie. I'm going to put a little eye shield so that just protects your eyes.
Okay.
Okay. I'm going to turn your chin up here like this. So everybody has a little skin crease underneath, and that's the area where you'll feel pressure. If you feel a pinch, you let me know. Everything is looking good. Are you feeling any discomfort at all?
None.
Me neither. So this is the insertion point where we will do some of the laser lipolysis.
Right.
Laser lipolysis is an Nd:YAG laser, and it tightens up the skin, creating a thermal injury because there's muscle contraction and scar tissue, and it breaks up the fatty tissue. I used to buy. Say that again, Sheila.
Love it.
I love it
I'm
too.
gonna take that one home.
That's right. Take the laser. You're so funny. So, pardon. Okay. So this is my fiber optic, and so I'll lean a little closer so that I've got. Thank you so much. So you can see the guiding beam here. All right, that's the Nd:YAG laser. Hello. Thank you for watching. Thank you for sharing. So, Sheila, you just hear me talking a lot. I'm talking to you, and I'm talking to we're doing our teaching video.
Right.
And you've seen some of our videos too, haven't you, Sheila?
Yeah.
Was that helpful to watch those videos?
Yes, it is. Very much.
Good. We try and be as transparent as possible so people can see what we do, how comfortable it is, how good our results are, it looks natural. And patients today, they're looking for a specialist that's going to focus exactly on what they do. Not someone who does a little bit of everything, but someone who really hones in on one area. That's all we focus is on the face and the neck and the eyes.
Right.
Skincare fillers, that's our area. Everything is looking great. We monitor the skin temperature with the laser. I monitor the energy we deliver, and I can also feel the skin temperature with my finger. So there's many different ways we monitor for patient safety. We have an outside consulting firm that monitors all of our safety practices too, to make sure we're always raising our standards. Thank you for watching. Thank you for sharing. Everything's looking great. Perfect. This also helps with hemostasis, that the laser cauterizes some of the blood vessels. Makes it easier for me to do my job. Happy surgeon, happy results. Everything's looking good. I'm gonna call Sheila later tonight to check in, make sure she's doing fine, and tomorrow my team's gonna see her, go through all the wound care and how to do the wrap. We normally see our patients at a 1-week follow-up, but they can come really to the office at any time. Most patients say, I'm fine, they're just relaxing at home and letting the recovery process take its course. People usually pass the grocery store test 7 to 10 days after the lift. You walk into the grocery, nobody really does a double take. And then we check in it a couple months later, we'll take some pictures before and after. We'll tell you what a great job we did. But we'll look at the pictures together and you'll see for yourself. After we do a treatment, our vision gets better and our memory gets worse. So that's why it's so important to have the photos Thank you for watching. Thank you for sharing. Hello. Hello, Angelis, Michelle, and Pam. Appreciate y'all watching. If you have a family member or friend who's interested in doing a treatment, give them a good resource to get it done right. Don't let them go somewhere that, the majority of injectors and cosmetic providers out there, they're beginners or intermediate level. So you gotta be careful. Go to someone you can trust. Don't let someone practice on your face. Very good. Hello, Betty. Good to see you. Hope you and your family are well. Everything's looking great.
Is that under the skin or
This is under the skin, that's correct.
Really?
And that's where it breaks up some of the fat.
You don't even feel it.
Are you feeling any pain at all?
None. No.
Yeah, you feel some pressure.
Oh, yeah.
You know I'm there,
That's
but
nothing.
yeah, you don't feel pain. That's the amazing part about the laser. It's pretty remarkable technology.
Yeah.
Hello, hello. Thank you all for watching. Thank you for sharing. Appreciate that. Good morning. We're in Tampa and the Villages, Florida. We've got over 35 staff dedicated to your care. I'm super proud of our team. They support us so well. I could not do it without our amazing team. I mean, they make my life so easy. I feel like I'm at the Ritz-Carlton every day. I mean, it really is a treat when I come to the office, especially now. We have such a beautiful facility, and there's so many fun things to do at our facility. We're getting it fitted out. We've got our TVs are coming soon. We've got our beautiful fountain, and our mirrors are great, our new chairs. I mean, you just got to come and visit our estheticians. Come get a Lux facial. You'll love it. Everything's looking great. Hello, hello. If you're just now joining, I'm Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. I am your facial plastic surgery expert. Honored to have patients from across the country and internationally that want a natural look, that don't want too much downtime, they don't want general anesthesia. You don't need general anesthesia. You don't need IV sedation. You don't need surgical drains. It's not necessary. You don't need surgical staples. So that's what we do, the image lift. And there's different versions, whether you do a mini, an image lift, or a mid. We customize it to your anatomy. I'm going to give this to you, Jamie. So for my physicians and students that are watching, so now that I've done the laser lipolysis, we elevate into the subcutaneous plane. Very good. Perfect. Katya or Peyton, I asked them to get some video of the training that they're doing there, just for marketing. We're doing some teaching today with our IPL. We've got a great IPL device and a clear lifting, which is also an ND-YAG laser.
Oh, tomorrow. Okay.
Thank you, Peyton. I just want to get some video of what they're doing there.
Okay.
Photos. Thank you. And it's so wonderful in our new room here. We got a lot of windows and we have the frosted glass so you can see what's going out there, but it's just beautiful to see the leaves and we're so lucky we live in Florida.
I know.
Come visit. The longer you stay in Florida, the harder it is to leave.
Yep.
Where are you from originally, Sheila?
I'm going to say Boston. I guess
Boston.
it'd be
Yeah, sorry.
Boston.
Sorry, the numbing medicine make the lips goofy. That's because of me.
Yeah.
My wife went to school in Boston, but
Oh, really? Where?
she went to Wellesley.
Oh, yeah. My cousin went to Wesley. And another one went to Leslie. And another one.
Yeah, and so, and we went not too long ago. My son plays the bagpipes in his school,
Really?
and they went to the Boston St. Patrick's parade
Oh, that's-
in South Boston. So much
Yeah.
fun. Boy, it was crazy.
Oh, it is. I lived there for quite a while. I worked for the New England Patriots.
Are you kidding? What did you
Yeah.
work for the New England Patriots?
I was the assistant and director of player personnel.
How long ago were you there?
Well, actually, it was a reformation of a team. You know, it was a, I can't even talk. The Boston Patriots, and then it went to New England. And when they built the stadium in Schaefer, we were housed at the Red Sox offices.
Wow.
That was the day of Carlton Fisk and all those guys. And I used
Wow.
to, yeah. Then we went down there, and I was there for about 5 years.
Wow.
I can't say Michael Kilroy was the player personnel director. and he was
Wow.
there
That's so
years.
cool.
Yeah.
That is so fun.
Oh yeah, it was one of my better.
I'm watching the Man in the Arena series with Tom Brady now, so I'm
Oh,
learning
yeah.
about the Patriots.
Yeah.
So you were there around 2000, or?
No, if you like the end of 19.
Good for
early
you. That's
1990s,
amazing.
Yeah, it was. I loved it. It was never a dull moment.
That is so cool.
And we were housed like in the draft. I was watching the draft the other night, and we were all locked up, you know, in our room.
How nice.
Couldn't go out. You had to have someone go out.
Ah.
Yeah, it was.
It's high security, huh?
Oh yeah, real high. It was neat.
So cool. Fun stuff. See, we have the most fun patients. We have the best people come through. We love to give to the givers. And Sheila's definitely a giver. Give to her work, her family. Now it's time to give to Sheila today.
That's exactly right. I raised 2 kids by myself.
Wow.
It's my time.
Wow. That's amazing.
Yeah.
All right. Hello, everyone, and welcome. Dr. Rich Castellano, the Smile Doctor here. Hello, Maria and Octavia. Hello, Dolce. Thank you all for watching. We're on a mission to stop bad plastic surgery, and we're here to help people do things the right way. If you're looking for a natural result that keeps you safe and something that's going to last, give us a call. People ask me all the time, they say, thread lifts, do they work? Yes, thread lifts work. They just don't last. And we didn't get those forceps in yet? I'll ask them. So, you know, and when patients want more of a result than what thread lifts do, that's when they come see me. Very good. Perfect. So I'm just doing some sculpting. With the local anesthesia facelift, I start with what we call the platysmoplasty. It's like a corset platysmoplasty, where I am stitching together the edges of the muscle. So first I just clear the fatty tissue. Everything's looking great. How you doing, Sheila?
I'm doing great.
So as you can see, with the Valium and local anesthesia,
Right.
patients feel comfortable. Some people fall asleep. They don't remember any of it. Some people we just have a nice conversation. So whatever you need to feel comfortable, that's what we do.
Now this is fine.
Yeah.
Yeah.
And this is the absolute safest way to do the treatment. There's no question about that. Very good. So I'm just trimming away some of the fatty tissue. We remove some of it with the laser lipolysis.
Take it off.
There you go. That's right. We figured you didn't want it anymore.
No.
Very good. Thank you for watching. Thank you for sharing. Hello, Susan. Let us know where you're watching from. We have viewers from all over the world and across the country. We're in Tampa and the Villages, Florida. We have a travel program. Come visit. We can set up travel arrangements. My friend from California came out, did his lift. I've had patients from almost every state in the United States come out. Perfect. And when patients come in, their family and friends follow. So we love getting referrals and taking care of family and friends of our awesome patients. A lot of people are unaware of what their options are. So I strongly encourage everyone who's thinking about having a treatment done, just get a continuity plan. That way you know what's right for you. Now remember, when you get a plan, depending on the level of expertise of the provider, you're going to get different types of plans. So you'll get a different plan here than you're going to get at most other places. Give us a call. We can do your plan virtually, even if you're coming from out of town. You feel a little pinch there or not really?
No.
So now I'm going to do a little bit of the stitching. So we use the 2O Ethibond, and this gets covered up in the scar tissue. There you go, so you can see the little 2O Ethibond suture. Okay. Very good. So we call it, of course, a platysmoplasty because we just stitch the edges of that platysmal muscle, those little bands in the neck, like a corset. You stitch it together. Perfect. You feel it get a little tight here, Sheila, okay?
Mm-hmm. Tight is good.
Tight is good. That's why we're here. That's what we signed up for. Perfect. Very good. So we put a few little stitches through here, and then I'll do a little more sculpting. When I'm done with this, just back and forth, little here, little there, then before you know it, you're done with the treatment.
Cool.
Perfect.
These dissolve, right?
So the deeper stitches, they stay with you. They get covered in the scar tissue.
Okay.
It's very rare. If they surface like a splinter, I can remove them. The ones on the skin, those dissolve.
Okay.
So that way you don't have to worry about them.
Mm-hmm.
Very good. Hello, thanks for watching. Thank you for sharing. Hello, Cheryl. Hello. So the procedure, good question. This is a local anesthesia facelift. We call it our image lift. Of course, we have different versions. We can do a mini or whatever version you need, image lift or a mid. But that's why we do an individual consultation so we can set the right expectations. If you haven't, you can download a copy of our book from Amazon. Just look up my name on Amazon, Rich Castellano MD. And we've got a couple of books. We guarantee we can make you look younger and the Smile Prescription. Very good. So now I go back after I've done the tightening, and I'm just going to do a little trimming of the fatty tissue to make the AC a little cooler for you. Thank you. Great. A little extra fatty tissue. I figured Sheila didn't want that.
Nuh-uh, you can have it all.
So we'll take care of that for you. No worries. We love doing our teaching videos. Sheila's seen some of our videos, and that is the best way for people. You know, the videos aren't for everybody.
Yeah.
Can you turn the AC a little cooler? Can you plug that in over there for me, please? Thank you. Hello, Bonnie. Hello, Barbara. Thank you all for watching, and please do share. Make sure you're following, so that way you can get our alerts. So I remove the fatty tissue with the laser lipolysis. I do direct sculpting, and then you tighten the muscle layer. But already I can see it's such a tremendous improvement. I'm very, very happy with what I see. Right here for me, please. Thank you. Great. Feel a little pinch there?
No.
I feel a little tiny pinch there. Very good. So these are my bipolar cautery. Uses electrical current to just seal the blood vessels. All my fancy tools. Perfect. We have a lot of seminars that we do. If you want to come out, our seminars are so much fun. We have patients that have had treatments done. You can talk to them and hear about their experience. You know, everybody's experience is different. When you talk to enough people, you get an idea of what it can be like for you. Perfect. Over here for me, please. Like a tennis match, back and forth, side to side. How are you doing, Sheila?
I'm
Everything's looking great. Stay over here for me, please. Very good. Hello, Tina. Thanks for watching. Thank you all for sharing. And make sure you're following so you get our alerts and updates. The team has their May specials going on right now, so give us a call. You can find out the latest. They always try and do good incentives for our patients to reward them for watching. And a little bit of cautery here. Thank you. Very good. You feel a little pinch there or not really?
No, not a thing.
Release totally, please. So I love the profile already. We're winning. It looks so good, but we're not done yet. Over here, for me, Gina. Just a little more to go. Then we're going to tighten around the ears. Lift totally, please. Right here for me, please. Thank you. So I just like to fuss over the little details here, make them just the way I like them. Perfect. Every little bit helps.
It's amazing how you feel those.
You know I'm there, but you don't know what I'm doing.
I know. It's like a.
And I tell patients if they feel discomfort, you feel pinch there?
Oh.
Feel a little pinch there?
No.
Okay, if you feel pinch, I tell them, tell me, and I'll put a little numbing, and then they don't feel it. So that's how it works. Do our best to make it easier than the dentist office. Yeah, I really like that. That's great. That makes me happy. Ready? Great. Now I'm going to turn your head all the way this way. So we make a hair-sparing incision that hides nicely. If you feel pinching, you let me know. You'll feel some pressure here. Very good. So this hides in the creases of the ear very nicely.
Good.
Very good. And then the post-auricular incision. You feel a little pinch there or not really?
Just a little.
Little bit? Let me do some numbing medicine. Can you bring that whole tray just a little bit? Right to here. That's good. Thanks. Thank you. Little tiny numbing. Little numbing. There we go. Very good. Tap please. Thanks. 15. You're forward for me, please. Hello, Arlette. Hello, Connie. Hello, Ileana. We are, Jamie, can you please retract that for me? Thank you very much. We're doing a local anesthesia facelift. Sheila, can we tell them how many years young you are?
76.
76 years young.
Yeah.
So proud of Sheila. Happy birthday to Sheila. Birthday's coming up. And she has many active years ahead. You know, people are living a lot longer.
Yeah.
They're doing a lot better. And they're looking better too.
As long as they're healthy,
That's right.
they'll go on.
You only live once, so we make the most of it. Perfect. Very good. This is a subcutaneous skin dissection, so we're accessing the SMAS layer beneath the skin. That stands for subcutaneous musculoaponeurotic system.
It's a toughie, yeah.
Say that again.
It's a toughie, huh?
That's a tongue twister.
Yeah.
Release totally, please. Very good. So you can see that this is the SMAS layer below. So I'm going to grab the forceps. Thank you guys for watching. Yeah, we have our comments there. You know, it's interesting because we don't use the word full traditional facelift. It's an image lift. Not to be confused with full traditional. Very good. And as you can see, there's very little significant bleeding, just these little areas, and I do some cautery to seal the blood vessels. Sheila, are you feeling any discomfort at all?
None.
Very good. I'm so proud of Sheila. You know, and I love patients when they come back and they tell me, they say, you know, I was not expecting how good this was going to make me feel. It really gives you a boost. Like it boosts your confidence. You just feel better about yourself. There's no doubt about it. We see that every day, and I just am so proud to be a part of our patients' lives. Okay, release please. Very good. Thank you.
Now, that was the skin on the right.
Yes?
All right.
Yes, that's correct. We're going to lift the skin. I'm going to turn your head a little bit this way.
Yeah.
Very good. Perfect. You know, about a third of my patients have had lifts before, so I'm very used to that. And if you've had a lift before, some patients say, well, can I have another lift? The answer is yes, you can. And of course, we take that into consideration. And then when I come across scar tissue from previous lifting, of course, I know what to do. And it does not hurt your result that you had a previous lift. It's just a different thing you take into consideration while you're tightening the tissues. Very good.
Is there a lot of scar tissue from the last?
I mean, there's some,
Yeah.
you know, it's not more than what I would expect, but your result is still phenomenal. I'm so happy. Really looks great. Big improvement, looks natural. Now when we see you back at your 2-month follow-up and we take pictures, you know, we do the 1 day, 1 week, and then 2 months. We have a saying that after we do a cosmetic treatment, our vision gets better and our memory gets worse. Roger for me, please. The vision gets better because after you do a treatment, we really scrutinize ourselves very closely.
Right.
Hello, Catherine. And the vision gets better because you're looking at yourself differently and more closely. The memory gets worse because most people forget where they started.
That's true.
We look at our pictures and we say, did I really used to look like that?
Really.
It's so funny, but that's why we have the pictures. I just saw a patient who said, you know, I needed to see those pictures. She's like, I just forgot what I used to look like. And if we're being hard on ourselves, we say, boy, I didn't get that much improvement. But then we say, wait, did I really used to look like that? That's okay. That's why we got the pictures. And we have our deluxe photo studio here.
Yeah.
One click for me so we don't wear off the knot.
Now, how long does it take, like, before you can apply makeup? Like,
To put on makeup?
you know, let's say,
Well, I mean, you could, so what's your question, Sheila?
like, how long would it take, you know, to heal before you can actually?
Oh, yeah. So there's physical versus social downtime. Socially, we get back into our routine. You can pass the grocery store test 7 to 10 days. You walk into the grocery, no one does a double take.
Okay.
But physically, within a day or two, you start your activities, not 100%, but
Yeah.
you can start doing your thing.
Uh-huh.
Very good. So for the preauricular area, I like to use the 4 ovicle, thank you very much, or 2 ovicle rather. You can see this here, that's our suture for my physicians and students that are watching. Hello, Jan. Thank you for watching, thank you for sharing. This is a SMAS plication. Very good. We'll have more videos coming soon. Make sure you're following so that you get our alerts, and make sure you're sharing. Don't let your family and friends go to someone who's not a specialist. Most providers doing fillers and injections and cosmetic treatments, they're beginners or intermediate level. There's a lot of them out there. And sometimes you don't know, but don't let people practice on your face. Thank you. Hello, Donna. Thank you all for watching. Thank you for sharing. So you see the extra skin. That's what we're going to remove. Just enough, but not too much. This is for Jamie. Perfect. Measure twice, cut once. My grandmother was a seamstress. I'm a seamster too, but just for the face. Is it a seamster if you're a guy, or seamstress? I just feel like it needs to be a little more masculine for seamster. Seamster, it sounds like teamster.
Yeah. My grandmother was one too.
Is that right?
From Ireland, yeah.
My mom made all of her own clothes in high school, and
I
so
did too. I did too.
I'm going to turn your head just a little bit this way.
I love doing it.
Me too, but not clothes. People ask me that, like, do you stitch your own socks? I'm too expensive for stitching socks. My grandmother did that for me. My socks would disappear and then they would show up again and the holes would be all stitched up. So everything comes back together. Pictures. And here's where we are. So I'm Dr. Rich Castellano, double board certified facial, plastic, and reconstructive surgeon. We'll see you in the next video. Bye.